South Africa's Health Ombuds has released findings into allegations that a Motherwell clinic denied Zenizole Vena proper care. The office has now instituted a disciplinary inquiry against 2 health professionals who attended to the 15-year-old patient. Health Minister Dr Joe Paahla says more training and more mentoring is required to avoid such incidents. Zola, Sholwana reports.
Investigations into the allegations of a patient who was sent away at the Motherwell NU11 clinic in Gqeberha after being gang raped have been concluded. 12-year-old Zenizole Vena was denied healthcare and later died at the Motherwell police station.
On whether Motherwell clinic failed to refer Ms. Vena to the next level of care, the investigations substantiated and confirmed this allegation. It can be concluded that both Sister Ntlangeni and Sister Ndongeni failed to refer the patient to the next level of care. Although Ms. Vena said that she was sexually assaulted, the 2 nurses who attended to her did not open a file and did not examine or even touch her. Instead, they instructed her to go to the police station because they believed that nurses do not touch rape victims in order to avoid tampering with the evidence.
The investigation further concludes that the nature of the deceased's health condition was not considered by the 2 healthcare workers.
On whether the death of Ms. Vena was due to negligence on the part of nurses at the clinic, based on the evidence obtained, it can be concluded that Ms. Vena was not attended to in a manner that is consistent with the nature and the severity of a condition by the Motherwell clinic.
In his reaction, Minister of Health Dr Joe Paahla says the department has to rectify such by providing more training for staff to avoid repetition.
It's no excuse. I mean, GBV and femicide, gender-based violence and femicide, it's a cancer in our society. So for any frontline health worker to say they are not aware what to do in those situations, I think it's totally so. But we must rectify that with the training, with the clear procedures, with the supervision, and also empower the communities so that they know that if after reporting they get nothing from the district, how do they elevate those up to ourselves at national level?
The National Department of Health has pledged to dig deeper into the matters of chronic patients experiencing neglect and a negative attitude in public healthcare facilities, putting a focus on Motherwell Clinic following a number of complaints. For Newzroom Afrika on Channel 405, I am Zola Sholwana at GCIS in Pretoria.